How to prepare for a thyroid ultrasound exam. A thyroid ultrasound is an imaging test used to see the thyroid gland. The thyroid is located in the neck and helps to regulate metabolism. A thyroid ultrasound is usually necessary when a growth has been identified on the gland. The ultrasound can help to identify whether the growth is a harmless cyst or a potentially cancerous tumor. A thyroid ultrasound examination does not usually require much preparation, but there are still several things to be aware of. Method 1. Preparing yourself. 1. Ask your doctor if you need to discontinue any medications. Before your ultrasound, you should speak with your physician to see if you need to discontinue taking any of your medications, vitamins, as some of these can affect the results of the scan. These medications might include antithyroid medications and thyroid hormones. As these medications are used to treat your thyroid, they could affect the results of your scan. That said, do not discontinue taking any medications without speaking to your physician first. 2. Avoid consuming iodine. Avoiding iodine in the days leading up to the exam will help the cells in your thyroid readily absorb the iodine dye that is used as the contrast medium during your scan. This ensures that your physician will receive the best results possible. Medications and other substances that contain iodine include iodized salt, multivitamins, kelp, cough syrup, amiodarone heart medicines, such as Pacer 1 or Cortisone. 3. Inform your physician about any contraindications. Make sure to tell your doctor about any risk factor or health issues that would make you an unsuitable candidate for undergoing a thyroid ultrasound exam. Tell your doctor. If you have had any procedures performed that used an iodine dye or radioactive material within 4 weeks of your scan. If you have, you'll need to reschedule your scan. These contrast mediums are capable of altering the results of your thyroid ultrasound scan. The cells in your thyroid will not readily absorb the iodine contrast material because they will already be overloaded with it. If you have previously suffered anaphylaxis, a serious allergic reaction, from any substance including shellfish or bee stings. If you are allergic to any medications. If you are breastfeeding. If you are or may be pregnant. 4. Wear loose, comfortable clothing on the day of the exam. On the day of the exam, the ultrasound technician may ask you to remove your clothing and wear a hospital gown for the procedure. For this reason, make sure the clothing you choose is easy for you to remove. If you remain in your own clothing, you will need to open the clothing and remove any jewelry that is near your thyroid, which is located in your neck, just below your Adam's apple but above your collarbone. Consider wearing a button-up top shirt as this makes accessing your thyroid easier. Method 2. Preparing your child. 1. Prepare the child for what the exam will involve. Before the day of the exam, it's important that you thoroughly explain what the exam will involve. The best way to do this is to pretend as if you are performing the procedure on her thyroid. This will help your child feel less anxious during the actual thyroid ultrasound, as they will be more familiar with the procedure. To do a pretend exam, ask your child to lengthen her neck as if she were a giraffe reaching for leaves on a tree. Squirt the ultrasound gel on. You can use a little bit of lotion. Use the backside of an ice cream scooper as the ultrasound wand. Pretend to be pushing buttons and looking at an ultrasound screen while you gently move the spoon around, above or below the thyroid gland. Remember to treat your child as if you are an actual ultrasound technician. Ask him/her his name, etc. 2. Bring various items with you to distract your child during the procedure. Some helpful items might include small toys, books, music, flashcards. 3. Try to prevent your child from moving during the procedure. An ultrasound examination is extremely sensitive to motion. Unfortunately, many children cry and refuse to hold still, which simply prolongs the procedure. Therefore, it's important that you keep your child as still as possible throughout the procedure, using distraction techniques, or promises of rewards afterwards if they behave well. Ultrasound technicians at the majority of facilities are familiar with the challenges associated with scanning pediatric patients, so they may also have some techniques that will help keep the child still. 4. Know that it may be necessary to sedate your child for the exam. Sometimes children will simply refuse to sit still for the duration of the exam, making it impossible to achieve accurate results. If the skin cannot be obtained at the radiology center, you may need to take your child to a hospital for his/her scan, where the exam will be performed under sedation. A hospital has the ability to sedate your child while also monitoring him/her during the scan. 5. Understand how sedation works. The medication that is frequently used for sedation is chloral hydrate. This is not a form of anesthesia, but a sedative. Chloral hydrate can be administered via an anal suppository, in a liquid form by mouth or with a naso-gastric tube attached to an oxygen face mask. You must have the thyroid ultrasound performed at a hospital if your child requires a sedative, because his/her breathing needs to be monitored during the scan. This is done to ensure apnea, a disorder that causes an individual to randomly stop breathing during a sleep, or respiratory depression, aka respiratory insufficiency, does not occur. The effects of the sedative usually last for a couple of hours. Tips. You or your child should not experience any discomfort during the ultrasound. Patients can resume their normal activities immediately following your thyroid ultrasound scan.